Hey everybody, this is Matt Shu from Upright Health, and today I'm answering some concerns that Marie-Yves Cosset out in France has, and that she posted in the comments section on my video on FAI. Marie has two major points of contention from what I can tell from Google Translate. Number one is she is a woman and she feels like what I talked about in that video doesn't apply to her because she's hypermobile and doesn't have the tightness that I mentioned in that video. Number two is that she thinks I'm being, I lack compassion for those who end up choosing FAI, surgery, to try to help their problem. So I want to be clear on the second point. I don't have a lack of compassion for those who do it. I actually feel very sorry for people who end up doing it because there's probably been a lack of options presented to that person. I actually I work with a lot of people who have either had surgeries or almost had surgeries and have family members who have had surgeries. So I have a very specific perspective on these things. But basically, unless you deal with a very, 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 very ethical surgeon, and they are out there, if you ask a surgeon what to do about your problem, it's going to be surgery. Okay, you ask me what to do about your problem, it's going to be train yourself better and work your muscles in the right way. Okay, there's my bias, and the surgeon's going to have their bias. Okay, now as for options out there, the options that are typically out in the medical world for FAI are pretty crappy. I mean, that's the way it is. The physical therapy protocols I've seen that they use for FAI, I actually just had a client bring in a packet of stuff, make me laugh and cry. Okay, they don't make sense. A lot of the things they do just don't make sense. So if you're only presented with cortisone shots, rest, physical therapy that just from the outset looks doomed to fail, and surgery, it makes sense that you would end up choosing surgery. Okay, you do all the other things that don't help because they can't, then you're left with surgery and then you hope that helps. There's been, I'm pretty sure, okay, I'm working with a radiologist who pretty much backs me up on this. There's just not enough evidence for the surgery, right? It's the same thing as back surgeries that have been done for back pain for the last 20, 30 years, right? It's, oh yeah, if we cut you up, we'll fix the problem. I don't think that's true, and I'm pretty sure in the next 10, 15 years, the studies are going to back that up. Now, as for, what you can do as a woman who is hypermobile, I've seen a lot of women with hip problems and FAI symptoms. I can't diagnose, but FAI symptoms who are extremely hypermobile. And Marie, you're correct that it is not exactly the same as with men because you're hypermobile. It doesn't, what I said in that previous video isn't exactly true. But the part of that video that is completely true for hypermobile women is that their posterior hip musculature does not fire when it's supposed to. It's not active enough, and that causes a lot of problems. So basically, when you're thinking, I lost my prop, but if you're thinking about the ball in the socket moving as you're flexing, let's say this is your knee and it's moving forward like that, so hip flexion. If you are not using the posterior hip musculature correctly, if it's not active enough, strong enough, firing at the right time through the motion, you're going to have the femur head moving funny, right? The ball is going to start to migrate in ways that it shouldn't migrate because it's not being held in place. And that's typically what happens with, generally I've seen this with women who do a lot of yoga and no strength training or bad strength training. They end up unable to flex their hips because number one, they're sitting all day at work, and then number two, they're doing a lot of yoga, which stretches out and deactivates the posterior hip musculature. Okay, so as you carefully train that activation back up and stubbornly train that activation back up, it makes a big difference for hip discomfort, pain, and all that nasty stuff that happens when your butt is off. So Marie, you are correct. Guys are a little bit different. We're generally really, really, really tight and inflexible, and that causes its own set of problems. Women like you who have done Taekwondo and are really flexible, your problem's probably very, very different because you don't need to bother with the stretching part. You have to start working on the activation part. So I hope that helps give you a little bit of a different perspective, and I hope this video helps many of you remember that pain sucks, life shouldn't.